Hi, I'm Selena Campbell, frequent host of the fertility podcast, This is Infertility. October is Breast Cancer Awareness Month, so this month we'll be releasing videos about topics that's very close to our hearts here at Progyny, and that's oncofertility. Before we dive in, we just want to say thank you to all of our subscribers and to encourage you, if you haven't already subscribed to the channel, please do so, as that will make sure you don't miss any of our videos. But it will also help others who are interested in fertility health to find this information. I also want to remind you that on our podcast, This is Infertility, we've recently published our Oncofertility 101 episode, where we deep dive into this topic. Oncofertility is a field of medicine that involves several different specialties. These different specialists include oncologists, surgeons, reproductive endocrinologists, and others. And the key to putting it all together is communication. This can all get very overwhelming for patients, but today we're going to find out how doctors work to make this all seamless for their patients. And we're going to do so with Dr. David Riley, a reproductive endocrinologist at Boston IVF and a clinical instructor at Harvard Medical School. Dr. Riley sees a lot of oncology patients at his clinic, and he knows firsthand how stressful and complicated this can all get for patients when not managed appropriately.
The key to being a good oncofertility specialist is communication. Let's use the breast cancer patient as an example because we do know that breast cancer is the most common cancer that impacts women of reproductive age. Well, that woman is going to have a medical oncologist. She's going to have a breast surgeon. She's going to have potentially a plastic surgeon and potentially a radiation oncologist. That's a multidisciplinary approach. And the approach that her team takes to her treatment will determine when she's going to have surgery, when she's going to have chemotherapy, when she's going to have radiation therapy. That can be overwhelming to a patient. That can be confusing for a patient. Now you add the reproductive endocrinologist to the mix, and that's a whole nother set of variables that she might find overwhelming. We're not going to let it be overwhelming. We're going to take control. Her oncologists, with whom we've created great relationships, are going to send that patient to me the minute she's been diagnosed. I'm going to determine her candidacy for this treatment. I'm going to do tests. I'm going to look at where she is in her menstrual cycle, and I'm going to send a note back to every person involved in her team. Can we get this done before she needs the chemo? Can we do it between her surgery and the chemo? Perhaps we can't do it. The vast majority of the time we can, and that level of communication and that multidisciplinary communication approach coordinates it in such a way that she will not be overwhelmed at all.
This is our third episode about oncofertility for Breast Cancer Awareness Month, and we want to thank Dr. Riley for participating. Dr. Riley and others like him are out there every day working for patients who need them. These treatments are life-changing for patients, and that's not something that is lost on Dr. Riley.
The most rewarding part of my job is any patient, for whatever reason they've ever seen me, is when they come back with a child that has resulted from our infertility treatments. But the most rewarding of that rewarding is by far the cancer patients. Couples who you see at their worst. You see when life doesn't feel very good and doesn't have much hope, and they come back and it's all erased. And I think about all the different things that medicine can offer people. I can think of none better than helping them have a family when not only was having a family potentially not a potential, but not surviving to have a family was potential. And when they come back with those children, after we have them come back and do the IVF, I can honestly say I feel nothing in my medical career has ever been more rewarding. It's fantastic.
Thank you for watching this video. Again, please click the like button and subscribe, as that will help others find it. Also, if you want a ton more information about fertility treatment, or anything else fertility related, we have a wealth of knowledge for you at progyny.com/education. And if podcasts are your thing, check out This is Infertility, wherever you get your podcasts. Thank you.